Life is complex, so is our mental health. It cannot be understood by diagnosis alone. Our philosophy is treat the person, not the mental illness. Hello, everyone, and welcome to another episode of Humanizing Mental Health. I'm Trent Akers.
And I'm Jeremy Alcorn.
Well, we're going to do another episode today of our Understanding Therapy series. And today, I think we're going to talk about homework.
This is fascinating because when we came in today, we had no idea what we were going to do.
Mm-hmm.
We're like, oh, hey, nothing set up today. What's something that we want to do? And you said?
Homework.
And I said, boring.
Yeah, and and you know what? That is, I think that's a very common reaction to people, like when they think of homework with therapy. Like it's like, wait, whoa, I've come in here. Like, isn't this my work?
Sure.
Yeah.
Yeah, in fact, if something that immediately jumped to mind, I didn't say before the mics came on, but was a piece of research that was done by Miller and Duncan. And I think that this is fascinating. It relates to why it is maybe that we want people to do something outside of the appointment. Now, you know what I'm talking about probably right away. Do you remember what that research was called?
No, I don't. I just remember, I think it was the results of that. And I think it was like if people do work after to integrate. I mean, there's several different ways that we can call this, but it's like their success rate is something like crazy, like 60 to 80% increase.
Actually, we're not on the same page. This is the no more bells and whistles.
Yeah.
Okay. As you look at me, I can see your eyes line up and go, oh, okay, wait a minute. Yeah, like I'm not talking about homework that was just specific, I'm not talking about research that was very specific to homework. I was actually talking about research that was about outcomes in therapy.
Okay, yeah. No, yeah, of course. I think we've referenced No More Bells and Whistles a few times.
Like, I think we may have, yeah.
And ladies and gentlemen, if you could probably, I'll listen to a few more of our episodes if you have already. You'll probably remember us bringing up this old chestnut where it's the relationship that accounts for 80 to 90% or more. I may be wrong.
It was 15% of change is technique, 15% of change is placebo, 30% of change is relationship. So inside the therapy session, the biggest part of the pie of change is that context of that relationship, the being attuned, being connected. And I'm interested actually in the 40% that's outside of therapy in this conversation. Why is it that we're asking people to do things between appointments? Because actually 40% of the change that happens in therapy is outside the appointment. 60% of the change is inside the appointment.
Yeah. And I think that's very key to, so it's not quite a 50-50 split, but it's nearly there.
Yeah, which is fascinating, right? Because we can only control what happens inside the room. Mm-hmm. And there's a whole bunch of variables that we can't control out in the real world. But one of the things that we can control, if not you and I as a therapist, one of the things that we can influence is asking someone to do something outside of the appointment so that they have this process of integration that can occur for them. Because I only have that person for 1 hour in the context of a week.
Yeah, well, and there again, too, I mean, I don't think that we've talked about this yet on the podcast, and I think you and I probably have looked at this. Like, do you remember where they've talked about structuring the therapy hour? Like, really, what the therapy hour looks like? Yeah, and you're grinning because you and I okay, ladies and gentlemen, this is the episode of pie charts. So, so the thing is that the typical therapy hour is supposed to be 50 minutes. So where it's like, your first quarter or your first 5 or 10 minutes is getting together with somebody and just joining with them, like building like your relationship building, warming things up, getting them in the room, kind of asking them how their day is. And then the other bulk of it, the other 60 to 80% is about like the issue that you're dealing with at the moment. And then your last 10 to or 15 to 20% should be that integration where you're kind of summarizing everything and sort of preparing, like we call that like your closing.
Yeah, like wrapping it together.
Yeah, absolutely. Because that's the one thing is that we with therapy, it's almost like my mother's a nurse, so I use the analogy of looking at wound care. So what you do is you unwrap the wound, you debrase the wound, you take out like all of the dead necrotic tissue if it's like that, and then you repack the wound, putting things inside, and then you rewrap it again so that people have that protection. Because especially when you're dealing with trauma, you don't want to have somebody activated and then let them out into the world again, because you're actually leaving them more scarred, and that's actually
raw.
Yeah, raw.
Mm-hmm.
And that was something that I really had to learn in my practicum was, when is that important? And that's where integration is really key, so that they're able to really have those connections with that, because our job predominantly, and I mean, is insight based. It's not just skills, but
sure.
Like skills are about that, but it's also about, how are you going to utilize that? Because our job is to really work ourselves out of a job.
Yeah, for sure, right?
Yeah.
And our skill in that process is coming back to Miller and Duncan's idea, is to try to actually pull in every single piece of that pie. Mm-hmm. That is that relationship process is not just about the person knowing me or feeling good in my presence. It means it is a relationship that is built in which there is sufficient trust that person knows that when I challenge them, I'm doing so because I care about how things are going to turn out for them.
Absolutely. And I mean, there again, too, we're heading right back into attachment.
Exactly. So that I'm holding space with you in the situation that you're in, but I'm also helping you to grow towards something. And that means compassion. It also means compassion that comes with some challenging things that you may need to work through.
Yeah, absolutely. I mean, for those of our listeners that have ever taken any child development classes, it's very akin to scaffolding that you do with children. Because the thing is that it's about showing them, and it's about supporting them, but then also giving them the opportunity to go out there and do it themselves.
Sure. So it's like we got that relationship piece that we need to be skilled at, and being able to convey that. We have the piece that is the technique that we integrate in. The placebo, often people think that's a trick. No, it's only a trick if it's a trick. Mm-hmm. If you give your kid a glass of water, I'm speaking from experience, and you drop some blue food coloring in it, you swirl it around, and you say, "This is sleepy potion." Well, then next thing you know, they take it and zonk, and that's a trick.
Well, yeah, but there again, too, I wouldn't necessarily, that's a placebo effect, but I would also argue, too, that's probably taking advantage of the natural melatonin and various things that is produced in the body already.
Sure. It's getting that internal self to match up with whatever healing process I need to. That's what placebo is. And it's not always a trick. It's actually the inner healer. So we want to anchor that as well. And the kind of what way I see it is that there's this bridge, the bridge between the appointment that you are in and what you're using with the person, and to what happens in the outside world is technique. Mm-hmm. So part of that technique is for them to practice things outside of the appointment. And that's where the sense of homework comes in.
Absolutely. Well, and I know that this is a topic that you and I have discussed before too, but this links into your you and I have talked about the difference between a clinician and a technician.
Mm-hmm.
You know, whereas a technician is somebody that tells you something, like how to do something, or just dispenses advice,
Mm-hmm.
versus a clinician, like in the therapy room, like we may role play or we may do different things, and that's being a clinician. And then the third step to that is, how are you going to carry that forward?
Yeah, for sure. And the big piece here, you said to me earlier when we were off mic, and I'd like to capture this. You said, I don't actually tell people I'm giving them homework.
No, I don't, because I think that homework is, it has so many connotations, and I looked at, usually what I do, like, because I feel that there needs to be a certain rhyme and rhythm, like whether you're doing individual therapy or group therapy, so that people get that sense of comfort. So when I have them come in, like they do the outcome rating scale, where it's basically it's measured so that we can look at how they're doing in the weeks in between, and then it's like, well, what's gotten better since our last appointment? Because I go from like a positive CBT perspective with that, because I always want to go strength based. And then I say this all the time to a lot of my clients, because I use a post therapy chart, which you saw the other day, which you like, and I'll say, we've talked about a lot today, what really stood out to you, and then they'll talk about that, and then I'm like, okay, because so they do the summary.
Mm-hmm.
And then I say, okay, well, what do you think would be meaningful for you to work on after our appointment today to carry forward what you've learned and what's
Sure.
important to you?
Mm-hmm.
Because I don't want, I can give people homework all the live long day. Like you and I, like we could pull things together, but it's your learning. This is your journey.
Sure.
You need to be the one setting it. And I've, like, sometimes folks will say, okay, well, do you have any suggestions? Or they say, I don't know. And then I've watched, Gabor Mate, and he'll say, well, I can see you're struggling. Can I offer you some suggestions? And that's where, that's where we can build things. And sometimes people will, take those. Sometimes they'll go in a completely different direction, different homework than I even thought. But that's what's meaningful for them. And then I'll, in the back of my mind, be like, they got something different from this than I did.
Yeah.
Are we working on the right thing?
Sure. Yeah. And it becomes really fascinating to me, because I think a lot of people then have this really negative connotation to homework, and it actually, that word, that idea, sets a kind of a power dynamic that they didn't like between student and teacher in school or whatever.
Yeah. Well, and there again too, we're talking about power over and power with. Whereas, like sometimes they'll just defer to us because they're like, well, you're the expert. You tell me what to do.
Yeah, in fact, I find this fascinating, because as we're having this conversation, something that jumped to my mind, and this has been like a transformative model or piece of information to me, and that is understanding, where does someone feel more secure? Do they feel more secure autonomously? Because that person's not going to take direction. It's like, no, like if you just tell me to do this or do this homework or that homework, it won't work, because they're autonomous and they don't want that. They want to figure that out on their own. Is this someone that actually feels much more secure when they are supported, when they are, in a more closely connected experience and they're not dealing with life alone? That person very, very much would like you to tell them what to do.
No, absolutely, yeah. Like, and there again too. I'm like, it's all about their attachment style. Is really what I'm hearing there. And then I wonder, like for you, because I had mentioned this off mic as well. If people, because sometimes like people say, oh, I want to work on this, and then one thing I always do is, I check in with how the week has gone, and whether or not, I don't always explicitly say this, but I kind of check in to see if they've worked on,
Yeah.
or maybe they worked on something else.
Sure.
If they've worked on something else, honestly, it doesn't matter as long as, they could come back to me and they could say, Trent, this didn't work.
Yeah, exactly.
Well,
Yeah,
or
yeah.
or if they haven't done any work in between, it's kind of like, are you ambivalent to
Oh, sure,
change?
sure. Like, where are you at in your own motivational level?
Yeah.
And are you in a place in which you're like, for me, when the person comes into my office, my expectation, and maybe that's a bad thing. Should we have expectations? But my position is, I anticipate you are going to heal. That's what I expect of you. I expect you to heal. I don't expect you to do it alone.
Yeah.
But I do expect you to heal, which means that I'll help you do that. But if someone comes in, and I think it sounds very judgmental, I don't mean it that way. Sometimes they would be referred to as a complainant. They've come in because they just want to let go of all of whatever it is that are their complaints, and then that's it. At the end of the hour, they leave. Well, I'm not that kind of therapist. I'm not interested in charging someone that amount of money for them to complain and have no integration in their life. But it also means that I look at where are they at, and are motivationally, just like you said, are they in a place in which maybe I need to recognize that they're contemplating the possibility of change, and they're ambivalent, just like you said.
Yeah, it's interesting that you bring that up, because I have some clients that would be, I've had clients that would be considered complainants, but like what I find, like, and I mean that can be frustrating too, but I've found, okay, how can we work with that? Like you want to sit there and complain. I mean, yeah, I'll sit back and I'll reflect.
Sure.
And sometimes I found that's a little bit of a slower road, but like I had a client yesterday where she had just this massive growth where, she had conversation with her boyfriend, she had conversation with her boss, ended up quitting her job, finding a new job, and like just slowly moving towards like building a better life for herself. And she said, and I said, oh, well, that's great. Like, I'm building on her strength. And she said, I wouldn't have been able to do that if I didn't have an environment where I felt safe to express my emotions, and then to transfer that into talking with these people. So it's all about like, how are we understanding what their process is with that?
Yeah. And it becomes actually what happened in this appointment before, then allowed the person to act in their real life. And then as they come back to you, they're integrating that change further.
Yeah. And that's exactly what I did with that person, because, like they went through all of these things, and I said to her, I said specifically, I said, okay, well, these are two specific moments. A, what did that feel like? Talked about what that felt like. And then B, how can you then take what you've learned and carry that forward with other things?
Yeah, like many times, just having that change talk, that it really is about what happened in between appointments, and how do we bridge that into what we're doing in the appointments.
Yeah. And I almost think too, because I'm wondering, what are your perspective on goals?
Yeah. For me,
yeah,
I often don't ask overtly. I find it to be a process of development in which, as we talk about the situation and the reason for them being here, it's more about what are you wanting to accomplish. I don't even think I use the word goal.
Like I almost find that goals And it's so interesting that you bring that up, because I have a similar feeling. And another client that I've worked with, he said in the therapist that he's had in the past, like, like they'll talk about goals, and then that's all they want to work on in exclusivity. It's like, okay, I don't want to talk about like the things that are around that. It's like, okay, how are you dealing with your anger, or how are you dealing with this or that? And it's like, that's a technician. That's not a clinician.
Yeah, like at least in my opinion, of course, there's these different ways in which people work, and for me, I think that the reason that some people seek me out has more to do with other people that have seen me. So someone sees me, I'm a good fit for them. Doesn't mean I'm a good fit for everybody.
Yeah.
But then a friend of theirs says, some problems going on. They go, oh, you know what? I know someone that could really help you. But the fit that is mine has to do with my personality, in which I'm not structured that way.
No.
I'm more in a less structured process. I don't work from that methodology that is really A to B to C to D. I can't do that, and it doesn't fit for me.
No. Well, and the thing is that's, well, I mean, here ladies and gentlemen, the Gabor Mate quote of the episode. Like, healing is a journey. It's not a destination.
Yeah, direction. Yeah, for sure.
Yeah.
In fact, it's written directly on your wall there.
Yeah. It is, because, like, and that's really, like, I mean, I think this is, Freud gets a very bad rap. In the sense that, like, he did, he did psychoanalysis, and sometimes
free association,
and people would be in therapy for years. But I mean, there again, too, you look at somebody like Carl Rogers, and he had in my mind, I mean, granted, I've only seen him work, like on the Gloria tapes, but I don't get the sense that he was like, okay, what are your goals? And here, boom, boom. Like, it was more of that avuncular style, that attachment style.
Avuncular?
I
don't know what that means, man.
Okay, so avuncular is kind of like a warm uncle. Avuncular.
Does the word actually connect to uncle?
Yes. Yeah. Yeah, I'm like that,
because I've been called Uncle Jer since I was like 8 years old, so maybe I'm avuncular.
You have a very Rogerian core conditions are very avuncular. Right?
Gotcha. Yeah. But so coming back to that core concept, then, for me, sometimes really directive homework, I've used that for sure. I've been used manualized therapy.
Oh yeah, Now we're getting back to 7 days to self-esteem.
10 days to self-esteem is one that I used often. But I've also used a DBT workbook, and really finding out how much structure this person is looking for. And then using something that is really research-based to guide them in between appointments. But for someone that is much more autonomous, I at times have talked to them about, you may feel motivated towards something. I don't know exactly what that might be. One person said, just don't ask me to journal. Right? Yeah, just don't ask me to journal.
Yeah, and believe it or not, like, I find that people don't like to journal, but that's also why too, with my post therapy chart, like, I've shown that to you, and like, it's breaking down the session, and that, but I also give people sometimes, like, for homework, I'll just give them the post therapy chart, and I'll be like, just look at this, reflect on what we thought about today, or what we talked about today, and then, if you can, just fill in the box at the bottom where it's like, what would you like to cover next time? And you know what? That actually has had some of the greatest impact for, like, I looked at this and this is what I want to cover, because it helps them collect their thoughts.
Sure, yeah. No, the fascinating thing is that same person that said, just don't ask me to journal. I didn't. And as we got to the end of the first conversation, I went, I wonder if there might be a resource for you in between appointments that might be really helpful. Do you mind, taking a look at this book? It's called When the Body Says No.
Oh.
And so then they come back to the next appointment. They're like, you'll never guess what I've been doing. I've been journaling.
But there again too, I mean, we're talking about a motivation, and the thing
Right?
is that the motivation came within them, and
Yes.
I think that's I think that's one of the keys, is that with homework, you, like, as a client, maybe it's behoove yourself to ask yourself, or if you're considering therapy, is that where did the motivation come from for
Yeah.
therapy?
Yep.
And where does the motivation come from to to make therapy work for you?
Yes.
Because I say to my clients all the time, I work for you, even if I'm being paid by an outside body or another individual.
Sure.
I work for them.
Yeah. And so it became this fascinating conversation in which the person then said, as I got into the material that I was reading, I had all these thoughts and feelings. I had to have somewhere to put them and organize them. And then they just started, and they started to reflect on their life as it related to the material that they were going through. And so it's fascinating to me, because I think that person is more of an autonomous individual. They will know what they need as they're going forward. And so sometimes I have that conversation that it's like, I'm not sure what that might be for you, that you feel this motivation towards something. For me, after my first therapy session, it was this creation of this mind map about how do these things connect together. And I went with that, and it was this integration that needed to happen. And you can't always know exactly what that's going to be. For someone that is less autonomous, they want maybe more guidance to know what that is, and they may anchor that homework from us more.
Yeah. I'll mention a friend of mine, because she, as a therapist, sometimes you have friends that all know what you do for a living, and then they'll either A, ask you questions, B, like almost want a pseudo counseling session, or C, sometimes they'll
Never
complain.
talk to you again.
No, well, yeah. C, never talk to you again, or D, they'll start complaining about the therapist there. And that's one friend of mine. She was like, I couldn't stand my one therapist. This was the second therapist that she'd seen, because she's like, all she wants me to do is listen to Brene Brown podcasts, and she's like, no, she's like, she wouldn't even tell me what podcast. She just said, go find a Brene Brown podcast. And the thing is that Brene Brown, I'm not saying that, those are probably very helpful and very insightful.
I imagine they are.
But what she said is, she said, my other therapist, I liked her because she would give me handouts and worksheets. And I looked right at her and I said, well, have you talked to your therapist about what you want? Yeah, what you want. She goes, well, no. and I'm like,
okay.
Well, and the thing is that, and I think, I may have mentioned this before, or I'm sure I may have mentioned this off mic or on mic, I'm not sure, but, we only do as well as we can with you if you tell us what you need.
Yeah.
Yeah,
sure.
I'm not a big fan of Dr. Phil, but I do like the one line that he says, if you're going to work with me, you got to be honest. And the thing is that, if you're not happy, then let me know.
Just
and
tell me, because we'll renegotiate it.
Absolutely.
And sometimes actually that's harder said than done.
Yeah. Well, I know, absolutely. It's because, again, too, it's about a relationship, and it's about your prior relationships that you've had, whether it be with helping professionals or just in general with your life.
Yeah, and the power dynamic that plays between people, and I think that we continually try to balance that. But, But I mean, I walk into a specialist appointment, and I'm going to be super frank, open, honest. I have actually zero fear of in just entirely challenging them, like just in saying, as they, even if they're to present an option or what they would recommend, saying, no, that's not going to happen, and these are the reasons that I don't agree with it.
Yeah, and I'm curious, Jared, how have specialists reacted when you've been like that?
I don't know. This has been an evolution in my life, because historically I would have been way too concerned about a feeling of conflict or something of challenge. But now it doesn't strike me that way anyway. So there's never actually been a problem. The I guess the just authentic and confident position in which I bring, they usually then would respond in kind, just in a frank and open way.
Mm-hmm.
But with that, I haven't had a doctor specialist that then became offended. So,
well, and I know, like, if they do, or if they do have umbrage with that, like if they have an issue with that, then it's more about them than it is about you.
Sure.
Well, and in a lot of respects, and like I think like just hearing your story, I think that's like being deferential. I think we're all taught to be deferential to power, and deferential because you're going in to an expert.
Yeah, for sure. And so that means that we can give ineffective homework. Mm-hmm. If people are in a place in which there's this power difference and they're not open to conveying that it doesn't actually fit for how they understand their problem or how they understand their solution, mm-hmm. or what they see would be helpful for them.
Yeah, and sometimes too, sometimes it's like there's even been times like where I won't even give homework because the person doesn't even have the capacity right now to work on certain things.
Sure. Yeah, absolutely.
Mm-hmm.
And sometimes the insight that we connect to is enough. Mm-hmm. Sometimes that is.
Yeah.
The paths are different for different people.
Yeah. And it's so interesting to me too, like as I've evolved in my career, and I think that you've mentioned this to me, like as a social worker, we have like various roles that we fill, and it's really interesting that like the other day, I was working with a client on SMART goals to help them figure out, like, because they wanted to do self-study and they didn't know like how to go about doing that. So like that was the appointment, and traditionally you would think, okay, well, that's not a therapist's role, but I mean, that does have therapeutic merit. And then how are you going to carry that through?
Yeah, for sure.
Yeah.
Because every single person has a different way that they relate to themselves, to their tribe, and to the world. Mm-hmm. And that's the foundation of being a therapist, is to try to be a detective in looking for the clues that they give you that say, mm-hmm. this is how I relate to myself, the world, my tribe, and us being able to fit into their process.
Now you make me want to style my office like Sherlock Holmes' den.
Yeah. And I would definitely, in this dyad, I would definitely be Dr. Watson. So.
Oh, very good. Yeah. Well, you would be the chronicler.
Yep.
Absolutely. Yeah. So I'm curious, Jared, what have you taken away from our conversation today?
Yeah, talk about integration, right?
Mm-hmm. Yeah.
Let's model this.
Yeah.
What are you going to do in between now and the next time we have this podcast?
Well, yeah, like and speaking of which, I think that it's it's kind of like just sort of reflecting, and I like that you brought up basically the difference between an autonomous client and one that needs that needs more structure. And I think that's a useful insight that I'm going to carry forward and really look at that.
Yeah. So as this piece of reflection to someone that's listening and they're wondering about how do I make therapy more effective for me, mm-hmm. Then a couple of pieces come together in this conversation we've had. This recognition that 60% of the change is in therapy, 40% of the change is actually in your world. So the integration is what is going to be your part in being able to advance that therapy forward. And in order for that to happen, then you really need to be able to communicate to the therapist what it is that is effective for you for that integration. If there's things that you would find helpful, that you need more direction, or that you actually would like less direction, being able to communicate that will be binding together and helping to increase that outcome, I think.
Absolutely. That was a wonderful summarization. And I'll have to talk to you about that, but maybe can we link? Do you know if we can link resources on our Facebook page or things like that?
Yeah, I don't know.
Well, because like what I would almost suggest to people, like if you can, find even a way. Again, we're talking about journaling.
Yeah.
Like one suggestion I would say is like even just going through that process with your therapist at the end, and like making it explicit for yourself about, like what you've taken from this.
Yeah, actually, Trent, maybe it would be more reasonable for us to just connect a resource as a link in the show notes, so people can look there for that.
Yeah. No, I'll see if I can find an online version of that post-therapy chart, because I think that if people so choose, that could be valuable for them. Yeah,
remember, I have ADD, so I'm not going to remember this.
No worries. It's all about it's all about that active memory.
Okay. So I'm not going to make an excuse. I'll just have to make sure that I track this. So when you look in the show notes, then hopefully we will have tracked this, and there'll be a resource or two in there.
Yeah. Our homework is to make sure that you have resources.
All right. Sounds good.
Cool. On that note, I'm Trent Akers.
And I'm Jeremy Alcorn.
See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.